Hello, beautifuls. Welcome back to my Chanel. And do I have a gorgeous treat for you today, my lovelies? So, if you remember, a few months ago, I reacted to a very specific cautionary tale video, shall we say. What are you doing?
We're feeling good about it. Other side, attempt number 2, but I didn't feel the needle.
About DIY home fillers, fillers at home, fillers that could potentially go wrong at home. So one of the only copies of this video I could find was one reacted to by Dr. Gary Linkov of City Facial Plastics. After that video went live, Dr. Gary Linkov's team got in contact with me and we came up with a wonderful idea for a collaboration, my loves. The collaboration that I posted on my Patreon and said, do you have any juicy questions you want to ask Dr. Linkov? Because today, my loves, we are going to be dispelling some plastic surgery myths. Firstly, I want to say a massive thank you to Dr. Gary Linkov and his team for making this collaboration thrive and happen. It's been months in the works and I cannot wait for you all to see it. So, my loves, without any further ado, my guest today is a renowned plastic surgeon based in New York City. He is a dual Ivy League educated plastic surgeon who has also spent time in Italy learning advanced arts. He is a pioneer of cutting-edge facial procedures and is rated amongst the top 3 plastic surgeons in the USA for reconstruction, body modification, and patient care. Please welcome Dr. Gary Linkov.
Thank you so much, Luxeria. Thank you so much for having me. Really appreciate
welcome. You are absolutely welcome. I'm so excited to have you on my channel, especially since we kind of started talking after a very strange video, very strange reaction to things that shouldn't be DIY, shall we say?
That's true. Yeah, absolutely. And I have another one coming out on thread lifting DIY, which is equally as scary.
Oh no, it's awful, isn't it? Yeah. Absolutely. I can't believe these people are so, should we use the word brave? Brave to do this on themselves? It's a little bit bizarre.
Brave and, I don't know, ignorant, I think too. I don't think they realize all of the possible things that can go wrong. And I think if they did, and if they saw the complications play out on themselves or other people, they wouldn't be doing that stuff at home.
Instantly, absolutely. I'm all for doing little things of DIY, decorate your house, make a rug, do your own makeup. Don't do your own injectables. That is the worst idea you can possibly come up with.
Right. Yeah, anytime, maybe if you're penetrating into skin, you should consider seeing somebody else.
Absolutely, a professional would always be good. So I'm going to get on to the questions now. So the first one that I have is, on my channel, I make a lot of videos surrounding plastic surgery transformations in the mid-2000s. On these shows, both myself and my audience have seen at many times some excessive use of plastic surgery. Has there been a time in your career where TV shows have influenced the amount of surgery that a patient wants or is considering?
Yeah, Absolutely. I think we have to look no further than the Kardashians, keeping up with the Kardashians.
Absolutely.
In this era. And then, people like Ariana Grande sort of setting the tone for what people aspire to, I would say. And that's guiding people's choices, and the aesthetic changes that they want to make. So for sure, I think it was true, decades ago, and it is true today that people look up to certain influencers and they want to be like them, or they want to at least understand what it takes to look like them. And that's the one of the purposes of my channel, is to kind of demystify some of these surgeries that celebrities are getting, and that it's not, that most of the time they're not telling the truth, that they just say it's my skincare line.
Literally. It's just a little bit of makeup. No, it's not, sis. That's an entirely new face. We live in such a strange world at the moment where it literally, almost everything you see on your screen is kind of altered in a way that just makes it almost a little bit believable, but completely unbelievable at the same time.
Yeah, I agree. It's almost like we're getting ready for the metaverse, where we're all just like a avatar of some kind that you can just tweak, but people want to try to blend that with reality. And then, certain pictures or certain unflattering angles come up and it's like, oh wait, is that the same person?
Absolutely. You see, it's what is it, tagged versus feed post, and it's oh, there's something very different there. I suppose in a way we can sort of think that TV does influence, influencers do influence if you can think of an average person that goes for cosmetic surgery, it definitely has an impact on the way they view themselves and themselves on a platform, I guess.
Yeah, totally. And also the popular trends and the procedures that people are requesting is also set by some of these individuals who have a lot of influence on everybody else, and people want to replicate it or emulate it. And it's very true. It happens.
Sometimes a little bit scary, I think. If there's trends in anything, perhaps plastic surgery isn't possibly a trend area. I think you should just get the brow lift because it's a hot trend. Doesn't seem like the correct motion.
Yeah, and then the other thing, Luxeria, where people like I think go wrong is they try to look like somebody else, and their like bony structure, their overall complexion could be very different, you know. And I always tell them like you're gonna just look like a different version of you. Like you're not gonna look like Angelina Jolie
Yeah.
or Brad Pitt or whatever.
Yeah, people forget it's not like magic. It's a tool.
Yeah, and it's all about I think optimizing one's own looks. I mean, it's not about turning them into someone like else, you know. I think
Absolutely.
ideally, I think like it's also just psychologically healthier when you say, okay, I want to stay myself, but just a better version
Yeah.
instead of like, I want to be a totally different individual who is on TV. I mean, that's not
It's
the healthiest approach because then what
absolutely.
happens is you end up chasing that. You end
Yeah.
up, you know, they get something and then you run and want to get something. Not a great way to live your life.
We see quite a lot of these plastic surgery, almost like lookalikes of
Hmm.
really influential people. And I always feel there's something a little bit like Uncanny Valley when it starts to get there. It's like, this isn't fun to watch or anything like that. I have a feeling that people are like hate viewing them. It's just a whole different kettle of fish when that comes up.
Yeah, yeah, and that's like quite a distortion of what plastic surgery is, you know, and it kind of creates a bad rep for the field.
Absolutely.
So, you know, it's they're extremes of what normally goes on. You know, usually
Exactly.
people who get plastic surgery are quite normal and they just want something tweaked or they want to look like a better version of themselves. But then, you know, that's not really what's shown to everybody.
No.
It's more of these extreme examples.
On these TV shows, they have a habit of showing more of the surgery and less of the recovery, only focusing on perhaps some like difficult moments in the recovery or anything like that. Is there anything specific to recovery that a patient should absolutely know? Or is it really a case of, in some of these shows, mind over matter?
Well, you're right, Luxeria. Like surgical results, they're not instant. And
Yeah.
sometimes you see a result, you know, right on the table, like on Instagram, they'll show it. And sometimes it looks actually better at that instant than it does in the days or weeks or months that follow. So to at least for because you know I operate only on the face
Yeah.
and the scalp, and on the face, like the trajectory tends to be pretty similar for most people, for most types of surgeries. So there's going to be like an initial period of swelling, and there's going to be a period where the incisions just don't look great, you know, and that could last for weeks to months. And sometimes, like for rhinoplasty, we tell people it could take like a year or
Yeah.
more for you to see a
Yeah.
final sort of shrink wrap result because the skin retains a lot of edema or swelling. So the results are definitely anything from like, you know, they're the furthest from instant. And I think people just need to be patient when it comes to surgical recovery and you have to have the right mindset. So like in the literature, for example, there are pretty high like depression rates in patients
Yes.
who get facelifts specifically, but you know that's just what's
Really?
been studied the most, I think, for that type of research. Yeah, but I mean, I'm sure if you put other types of facial surgeries in there, the same would be true too. But we know that for at least the first few weeks after, say, facelift surgery, people can be like they can be depressed, you know, because they went in trying to look prettier, and here they are like bruised up, swollen with incisions and drains or whatever it
Yes,
might be.
absolutely.
And so you have to be mentally prepared for that. And a lot of times online or on the TV shows, like we're not getting a glimpse of
Yeah,
that
you never
recovery
see it.
process.
Never see it. It's always just the magic
Yeah.
before and after, even if that's
Yeah.
been a year or so.
Yeah. Yeah. Exactly. So that's just something that isn't talked about enough. But it's very true. And hopefully at least your surgeon prepares you for it. You know, there are
Yes.
times when even the surgeon will kind of gloss over that and not give you like the full scoop on what to expect. And that's problematic too. And that enters into, I
Yeah.
know later we'll be talking about how do you pick a doctor, a
Yeah.
surgeon. And I think that's part of it, you know, someone who can properly like take care of you and set the right expectations for after surgery too.
Absolutely. I'm definitely a great fan of get like more than one opinion from lots of different people just to really
Yeah.
understand what is actually able to be done. Because unfortunately, in every industry, there's those that are maybe a little bit charlatan, that are just like a little bit
Yeah.
nefarious, that aren't potentially the best examples of who to go to. I certainly
Right.
have come across a few of those in my lifetime that I would never go to, would never go to. So, following on from recovery, during one consultation I had with a doctor, I was told to use arnica to help with
Hmm.
bruising and scarring. Is there any truth to using topical supplements for healing after a plastic surgery?
Yeah, arnica can be taken as a pill or as like a
Oh,
topical type of cream, yeah. And overall, the results are quite equivocal, meaning that some studies show that it really does help reduce the bruising post-operatively, and others showed no difference, compared to a placebo. So we don't really know, how much
Yeah.
benefit. The odds of it, hurting you are very low. So
Yeah.
I would say the only concern with like a topical is that if you have, incisions in the area, it might not be good to get the arnica into those incisions, the
Absolutely.
fresh ones. So sometimes the pill makes more sense, and you can start that a day or two before the procedure and continue
Oh,
usually for about 3-4 days after. But like other topical supplements are just not well studied. And so I just prefer to like stick to honestly like the tried and true.
yeah.
So that would be like occlusive dressings for any incisions where you're using antibiotic ointment usually in the first few days, and then you switch over to say like an aquaphor. You're keeping that covering on the incisions, and it allows the cells to grow in better. So that's like in the early period. And then we switch people over to scar gels usually. And that
Oh,
starts like as early as usually about 12 days after a surgery, where the incisions, they shouldn't be bubbling from like hydrogen peroxide. If you were to test it with peroxide, once that bubbling is over, that means it's fully sealed, and then it's safe to put like a scar gel on. And we know scar gels for at least the first 3 months after a surgery can really help improve the appearance of that
amazing.
ultimate scar. So I try to stick to things that are like scientifically proven, and
Absolutely.
but sometimes you're getting all these different supplements thrown at you, and it's just like there's no
Yeah.
good data to support it.
The supplement industry is rife with like non-data, I think, like definitely a lot of opinion posts and things like that. But how
Yeah.
brilliant is chemistry that we can just like improve the appearance of scars? It just makes me so excited for like the future.
No, totally. It's funny you mentioned chemistry, because I'm literally like talking to an organic chemist now about
Amazing.
formulating like our own scar gel. We wanted to make one that was like really high quality and would still be affordable to people. So we're in the process now. I was just talking to an organic chemist like
That's
last week.
incredible.
But it's amazing what they can do, yeah, because it's like he started telling me all these things that I don't remember. I mean, I
No,
took organic
of course, yeah,
chemistry,
yeah,
but
absolutely. It could be also
I
a bit of
don't know.
NDA, yeah.
Yeah. But it's like, and then he's like, oh, we got to put like an oil in there to like make it like work better on the
Spreadable and
skin.
yeah.
Yeah. And I'm just like, yeah, this is like totally new to me. But we're basing it off of products that we like. And so that's a new project for
Oh,
us.
brilliant. That's so exciting. Oh, I
Yeah.
can't wait to try it potentially in the future.
Yeah. Well, we'll send
That's
you
so
some.
exciting. Oh, thank you so much. I'm so excited for that.
Yeah.
That's amazing. Didn't expect that. Thank you.
We're in the early
Incredible.
stages though. It's just the formulation stage.
I absolutely adore a bit of formulation. Absolutely. One day
Yeah.
I will have my own cosmetics line and I am formulating that
Yes.
from scratch. So one day. Very
Absolutely. You should.
exciting.
You should.
Very
Yeah.
exciting. Oh, thank you so
Totally.
much for sharing that. So, on my channel, we have a joke about everyone gets a brow lift on the show, The Swan. Do certain procedures like that go in and out of fashion?
Yeah, and it's for different reasons, but I think as a surgical community, like just on my end and my
Yeah.
colleagues, like I think we can do better with like taking a step back and really saying like to ourselves, like, are these people, it's not just one person, are these
Yeah.
people looking better like after certain surgeries? And it's amazing to me that for like decades, like people were doing brow lifts where the entire complex was lifted way up, and everyone just looked like shocked, surprised. And now it's like, as a community, a surgical community, we're realizing like, oh, well, maybe we should just focus on the lateral brow, and maybe the entire brow complex doesn't have to go up,
Yeah.
because it hasn't dropped that much over time. And so like it's amazing to me that it took so long. But when I go to conferences, I can see like why that like plays out, because usually like the people speaking at conferences, or at least the traditional ones, it's like, the guys with the gray hair have been doing it for 30 years,
Yes.
and it's like
Yes.
everyone has to just listen to them. And you almost feel weird if you like have a different aesthetic from what you're seeing, and they just show all these pictures where you might be like a lot of times I'm like, wait, that doesn't look better in the after, like that looks fake or whatever. But like there isn't a forum for raising your hand and telling the
No,
senior guy
no,
that like it looks
exactly.
like crap, like
Yeah.
it would be nice, because then maybe they could change the way they've been doing things. And then like from a patient's perspective, like a lot of patients want to go to someone who's been doing this for 30 years. But
Yes,
what if
exactly.
they spent 30 years creating unnatural results? Like, yes, like they have a lot of experience, but it might not be exactly the aesthetic that you're looking for. So there's a lot of that. I mean, that I guess opens the door to other types of questions.
Oh,
But coming back
absolutely.
to brow lifting, I
Yeah.
mean, yes, like specifically with brow lifting, like we've transitioned as a field away from like full brow lifting for most people. I mean, some people could still benefit, but most people, like it's just the lateral brow that's dropping. And I'm not talking about the fox eye look.
Yeah,
That is
exactly.
a distortion, I think, of what looks natural personally.
Yeah, I completely
And
agree.
it has risks, and you know, I don't do that surgery for young patients. I mean, I think a lateral brow lift works wonders for people where the lateral, like the tail of the brow has dipped below the level of like the head of the
Yep.
brow on
Yep.
a horizontal axis. And like most of the people who want that fox eye look, they're young and they have no signs of aging, and I just think it doesn't look great.
It starts to step into more of like body modification rather than like construction or making things look more youthful and a little bit snatched. It's like you want to go literally like full wind tunnel mode. I have noticed
Yeah.
this trend. I really have. In fact, before I even wrote out these questions, the fox eye was kind of on my periphery, but literally it's all I hear about now is people being like, I want the fox eye. I want the fox eye. And it's like, are you going to want that in 10 years? I'm unsure about that.
Right, right. Go try to reverse that. It's not going to be so
Exactly.
easy. And then it doesn't really last forever, but then you know people are going to want to maintain that because it becomes in their mind like the new normal.
Mm-hmm.
So they're going to keep getting the same surgery, and then a lot of times the surgical type of it, because there's like thread lifting you could do to give
That's
yourself
true.
at least a temporary thing, but the surgery is, you know, I'm a hair surgeon too, so like you know the surgery is
It's,
it's behind the hairline, it's
yeah.
like in a couple of hair, but like there's a high risk of alopecia and losing hair by the incisions. So then like what are you going to be getting, like hair transplants to fill in the lost hair
Exactly.
and then
It
getting the
starts to be
surgery
a
again?
puzzle, doesn't it?
Yeah, yeah, just chasing the tail at that point.
There's so much more to it than you think of when you first sort of like think about these ideas. There's so much more like consideration of like things down the line, which is why I always feel like people should go to more than one consultation with a surgeon to find out exactly what it is that they're going in for, really, and to find
Right.
like the best surgeon for them.
And then the other, yeah, and absolute Luxeria. And also, like, I'm shocked when I tell a patient that they're not a good candidate for surgery, at least in my opinion, that they sometimes will argue with me. And that to me is just shocking. Like, if a surgeon tells you no, like, don't try to convince the surgeon that they should do your surgery. Like, go to someone else. Maybe they, you know, their views will align better with yours, but you never want to push a surgeon's hand to like operate, you know,
Yeah.
because our default is to operate. We like to operate. We
Yeah.
enjoy it. Like that's what we do. We like, you know, the process of it and improving people's lives with whatever kind of surgery it is, not just with plastics, but like if a surgeon tells you no, like listen to what their reason is and internalize that. And then, like you said, maybe get some other opinions. And if multiple people are telling you no, like
Yeah.
really
Yeah. The
listen to
writing's on
that.
the
And
wall.
there is a
Yeah.
strong reason. Yeah, you don't want the surgeon who's going to say yes to every little thing that
No.
is requested.
I completely agree with that. I think it's one of these things. I was actually watching your buccal fat removal video where you were
Hmm.
talking about like why you don't necessarily do that procedure anymore,
Yeah,
and I
yeah,
was fascinated to hear from someone so calmly explaining like a level of almost like professional, not anxiety, that's a bit of a strong word, like professional caution of being like, I sort of like don't look forward to it if it's on my schedule, and I was just like, that's
yeah.
so refreshing to hear from someone that is in like a position of authority about their role, because sometimes you just hear of people being like, I don't like doing it, but I'm going to do it anyway, kind of thing, and you just think, well, I'd
Right.
rather go to someone who really enjoys it or something like that. Like, it's so heartwarming to hear that because you just don't
That's
usually
how I
hear that in the
really, I mean,
industry.
that was like the truth. Like that's how I felt, you know, during those procedures or right
Mm-hmm.
before those procedures. And I didn't enjoy the feeling. And I, you know, so yeah, and that was just one of the reasons, you know, why I stopped doing
Yeah,
that procedure. But yeah, I mean, I think like we have to always like listen to our patients
absolutely.
and listen to just kind of the overall community, but also like you have to listen to yourself and how, you know, you're feeling inside, because all of that gets expressed onto like your surgical results, I think.
Absolutely, absolutely. Oh, we're really getting through it today. The most infamous plastic surgery trend that I've personally seen over the last few years, which I'm sure you're very
Mhm.
familiar with, both through friends and places like Instagram, is the BBL, the Brazilian butt
Yeah.
lift. Is it really the most dangerous procedure out there, or is that little bit clickbaity myth?
Yeah, so you know, I don't do that
No,
specific
exactly.
surgery,
Yeah.
but I mean, of course, you know, I know a lot about it, and
I'm sure
also
you
like
probably get a lot of questions about it as
I
well
do, I
online.
do. Totally. And also like we have a small like outpatient sort of office-based surgery center that I oversee as like the medical director of it.
Oh,
So like we have people who come in and they want to do these surgeries, like they're full body, whatever, plastic surgeons who want to do BBL. So I've had to really look into this to make sure it was like safe to do in our surgery center. So yeah, definitely read up a lot about this,
yeah.
and it's an interesting trend and surgery. And it is true that it really is the cosmetic surgery with like the highest mortality rate, which is
Is it
crazy.
really? Wow.
It's like 1 in 3,000, which is like
Oh,
really high. I
yeah,
mean,
that is.
higher than any
Oh my
other cosmetic
gosh.
surgery that's
I had
out there.
no
And the
idea.
cause of those deaths, it's like uniformly fatal fat embolism.
Oh,
And it's
okay.
from the fat entering into like the venous circulation, from like the gluteal veins, like in that region.
Yeah.
And so even if you try to avoid those like gluteal veins, usually they live a bit deeper, like under the skin, and trying to place the fat like outside of the muscle where those veins are, there's still a chance of getting one of these complications, even in the
Wow.
best of hands. So it's very high risk, and it amazes me that I think a lot of people have heard, maybe not the specific statistics, but that it's dangerous,
Yeah.
and yet they go for it, and they're like, oh yeah, but I still want that. And now there's been this like, I guess maybe partially also because of what the Kardashians are doing, but almost like
Yes.
a reversal.
Yeah,
So then
yeah,
it's like,
literally. Before I was finished with writing these questions, I've now heard of people getting the
yeah,
reversal of the BBLs. So that's just goes to show that trends in plastic surgery are absolutely a thing.
I know. And it's just like, yeah, you went through this one surgery that had such a high risk of mortality, and now you're going to try to get it reversed. I think the reversal is generally safer, but
Yeah.
still, it's just like, I mean, at some point, people just have to choose, I think, safety first. And
Yeah.
I'm a huge proponent of that. Why would you risk your life for a cosmetic improvement? I mean, a risk beyond what's, like normally acceptable. I
Yeah,
mean,
like
there's
normal
any
considered risk.
yeah, exactly. I mean, anytime you go under for like
Yeah.
an anesthesia procedure, like there's always anesthetic risks, which are usually the highest risks for death, if you will,
Yeah.
like when it comes to the cosmetic surgery. Like none of the facial procedures that I do have like any real mortality risk. But going under always carries
Yeah.
some very, very rare thing.
Yeah. Wow, I had absolutely no idea that it was from embolism. That's absolutely. I mean, it makes
Yeah.
the most sense, really, because if you think about it, it is just like fat redistribution, isn't it? It's like liposuction and fat reinsertion, basically. Wow,
It
how
is, and that
dangerous.
fat can travel, that it can settle into like one of those, because the gluteal veins are not small, and so they have some girth to them, and the fat goes inside, and then it travels into the rest of our circulatory system, and it can block up, major vessels in your
Yeah.
heart and lungs.
So definitely something to be considered. Like, don't necessarily always go for a BBL. Think perhaps of something else first. But
Yeah.
following on from the BBL, there's recently been an alternative offered by filler practitioners in the UK. Basically, a
Mhm.
large volume of filler is injected into the hips and buttocks to create a faux BBL, sometimes with over 100 milliliters of something like hyaluronic acid. Is that actually a good alternative, or is filler for surgery a myth?
Well, first of all, 100 mLs, like who can afford that?
It's a lot, isn't
That's
it?
insane. I mean, is it? I wonder if it's like the real syringes of, of the stuff, because I mean that's really costly. So but yeah, but more power to people who can afford that. And
Yeah,
then
yeah,
beyond that, like should that be done? The same type of risk as we just talked about with fat applies to really anything you're putting into that region. So the condition or the complication is actually called a fat embolism syndrome, and
oh,
it clinically presents in the same way. And even though it's not fat, it's still kind of
yeah.
called that because that's usually why it happens. But the HA fillers or any other kind of filler, like some of the more permanent ones, can still give you this type of problem. It's just like substance or goo or something
Yeah.
inside these big veins
Oh,
that's causing
goo
the
in the
problem.
veins doesn't sound great, does it?
Yeah,
Absolutely not.
yeah, definitely not. Yeah, so I don't think it's any safer. But it's, I guess, an alternative to using fat. And that's
Wow.
the case with any sort of filler.
Yeah.
When people talk about filler could be HA filler could be fat. It's still just like any kind of, it's still just types of filler. Yeah. So same risk applies.
Same risk. Oh, goodness. Unfortunately, those filler practitioners in the UK usually aren't doctors. So that's something, another layer of something to worry about, I suppose. So I've come to the end of my questions. I now have a couple of questions from my gorgeous Patreons at home. So we have the Marked Maiden has asked, is choosing a plastic surgeon like choosing an artist?
Well, it sounds like a nice thing to say, and I would love to say yes, pick the best artist. I'm gonna go with not really. I think you definitely want a plastic surgeon who has some type of artistic ability.
Yeah.
But I think going back to what I said earlier, that safety is first and foremost. So you want a plastic surgeon who's at least express some interest in protecting you and keeping you safe. So that cannot be overlooked, and it's something that I think a lot of people just take for granted because they just look at before and after. Oh, this looks great, and they're popular. They have a big Instagram account. Let me just go with them, and like not so fast. I mean, this is like your life in a way that you're putting into someone's hands, and because like let's say you might say like, oh well, I'm just getting, I don't know, a tummy tuck, like that should go well, right? But if you're getting anesthesia, like who's the anesthesiologist?
Yes,
like,
exactly.
Like are they selecting the best people for that? Like we're very selective in our office-based surgery center, like who we bring in to provide the anesthesia, because like if I can't feel comfortable and my patient's safe from that, then how am I going to do a good job with the rest of the work? So that's really important. And then other things to look for would be like board certification, and not just like there's so many different like boards out there, but you want to make sure that they're part of some like core board that has like very rigorous training and requirements to get into it. And then if they have extra board certification, great, fine, but there are certain core boards, and I don't know how exactly it is in England, but here there's just like there's some core ones, and then there's like everything else. And so that's really important, because some people they get misled and they just see board certification, like, oh yeah, he's board certified.
It could be cardboard. Like
could be cardboard certified. Yeah, that's true. So assessing reviews, like looking at the before and afters, doing a consultation, and then like feeling like you have some connection with them, because again, after surgery you want to make sure they don't like desert you and like, oh, like they had a complication, I don't want to talk to that person anymore. Like you don't want to be in that position. You want someone who's going to be there for you, and not just do the right thing during surgery, but like after too. So it's like all those things. So the artistry is like just a portion of that.
It's a portion of something to be considered.
Yeah.
Thank you for asking the Masked Maiden. That's quite an interesting question, actually, because I suppose, as you were saying, there is an artistic level, because it kind of is like, well, it's an aesthetic industry. It's part of the aesthetic industry, but there's so much, like, if aesthetic is the top of the iceberg, under the iceberg is so much of almost like the professionalism that needs to happen in order for everything to go smoothly.
Absolutely. Well said. Yeah.
Oh, thank you. So my other Patreon, Sexy Texy RN, has asked, adverts for non-invasive procedures have been everywhere currently. For example, is cold sculpting actually an alternative to liposuction or like tightening up of the jawline, or is it a scam that will give my wallet a scandal? Very appropriate.
I love the way they phrased it. That's really clever.
It's cute, isn't it?
Yeah. So here's the thing. So like there are surgical and non-surgical modalities to address some, concerns or goals that someone might have when it comes to aesthetics. And they all have risks and benefits.
Yes.
And some people think of surgery as like so scary and having such high risks, but they sometimes fail to appreciate the risks of non-surgical modalities that really do exist. And what I usually say is that something that has no risks likely also has no benefit.
Yeah,
and
actually, that's a very good way of looking at it.
Some people want something so safe.
Yeah.
If you want something so safe, like it might not do anything for you, like a jade roller. So with cool sculpting, just like any other non-surgical modality, for fat reduction, it has risks, has real risks. It can cause burns. You're basically trying to freeze these fat cells. The fat cells have a little bit more susceptibility to being frozen and undergoing apoptosis or cell death compared to some of the other cells. And the cool sculpting technology kind of tries to take advantage of that. But, those burns, if that happens to you, can lead to scars later on. There's also the phenomenon of paradoxical fat hyperplasia, where you go to reduce the fat, but like the fat cells are like, F you, and they get like 5 times as big. and then you get like this puffy look, and then you need liposuction to get rid of that.
Yeah.
So, you know, the costs add up. So make sure, you know, in getting some of these non-surgical things that you're going to someone who's licensed, who knows what they're doing. And surely certain things, like if it's just basic, like say microneedling or something like that, there might be a good medical esthetician, for example, who can do that. Or like if it's Botox and filler, I mean, if there's a really good nurse who's been doing this for years, I mean, they're qualified to do this stuff in most parts of the world. It doesn't have to be, you don't have to go to a plastic surgeon for every little, you know, every type of procedure that's non-surgical. But make sure that they really have experience, that they know what they're doing, and have at least the appropriate license for whatever it is that they do.
So I guess in that sort of a case, it's check licensing, check references, and check like the bank of work that they already have, and speak to other patients that have been with them to find out like a well-rounded answer.
Yeah, absolutely.
Well, I've come to the end of my questions. I do actually want to say thank you so much for joining me here today. I also want to say a massive congratulations for sailing right past 100,000 subscribers. I looked this morning and you're on 174. I know, can you believe it? Amazing. Absolutely incredible.
We're doing it.
We are, goodness. Right, here's to an excellent 2022, and I cannot wait to see more videos that you produce this year.
Yeah, the feeling is mutual. Thanks so much, Luxeria, for having me, and look forward to collaborating more in the future.
Absolutely. Thank you so much. I hope that we do again. Anyone in the comments who wants to ask something, please go ahead and we shall see what we can do in the future. Well, my loves, wasn't that a juicy little conversation? I can't believe I learned so many things about why BBLs are so dangerous and how plastic surgery trends have changed over time, from something that was seen as like everyone must have one to like now we only really need to do it in a considered certain amount of cases. Absolutely fascinating stuff. I love talking about plastic surgery and learning every little thing. I mean, what's that phrase? Knowledge is power, and power is in the Browlift, my loves.
Good heavens.
Once again, I want to say a huge thank you to Dr. Gary Linkov and his team for working on this collaboration. I think it was a swimming success. Let me know what you think about what we've covered in today's video in the comments box below. And with that, my lovelies, I want to say a massive thank you to all the Patreons who got involved in this project as well. Thank you so much for supporting this channel and allowing my endeavors to thrive and survive. And with that, my lovelies, I will see you in the next video.